Can doctors see endometriosis cells on a biopsy? Imagine trying to find tiny clues that reveal the presence of endometriosis. Doctors can indeed see endometriosis cells on a biopsy, but it's not always straightforward. When a woman undergoes laparoscopy, a minimally invasive surgery, the surgeon looks inside the abdomen and pelvis for suspicious lesions. If they spot areas that look abnormal, they can take small tissue samples from these spots. These samples are then examined under a microscope to look for the hallmark signs of endometriosis. The key features pathologists look for are endometrial-like glands and the surrounding stroma, which is the connective tissue that supports these glands. These are the same types of tissue found inside the uterus but located outside it in endometriosis. The presence of these glands and stroma outside the uterus is what confirms the diagnosis. Sometimes they also look for hemosiderin-laden macrophages, which are immune cells containing iron pigment from old bleeding, often seen in endometriosis lesions. However, it's important to understand that not every biopsy will show both glands and stroma. Studies suggest that only about 50 to 70% of biopsied lesions contain both components clearly. Some lesions may be atypical or have only one of these features, making diagnosis more challenging. To improve accuracy, pathologists often use special staining techniques, like immunohistochemistry, which can highlight specific proteins associated with endometrial tissue, making it easier to identify. It's also worth noting that taking a biopsy of the uterine lining itself, called an endometrial biopsy, does not diagnose endometriosis. This is because endometriosis involves tissue outside the uterus, so sampling the uterine lining alone won't reveal the disease. Instead, diagnosis relies on visual inspection during laparoscopy combined with tissue sampling. While imaging tests like ultrasound and magnetic resonance imaging can suggest the presence of endometriosis, they cannot definitively confirm it. The only way to be certain is through tissue diagnosis, which involves identifying endometrial-like tissue outside the uterus on a biopsy. In conclusion, yes, doctors can see endometriosis cells on a biopsy taken from suspected lesions during laparoscopy. The process involves microscopic examination of the tissue to find characteristic glands and stroma. However, because not all lesions show these features clearly, diagnosis can sometimes be complex and may require specialized staining techniques. Confirming endometriosis through biopsy helps guide treatment options, especially when fertility is a concern. Always remember, if you suspect endometriosis, consult a healthcare professional for personalized evaluation and care.